Hello, welcome to Pathagonia. This is Jay. Today we're going to use Kurt's notes to talk about small round blue cell tumor differentials in children. If you already haven't, look at Dr. Shabrich's website. It's got great resources for pathology residents like myself as well as pathology staff. So let's begin. One differential is leukemia lymphoma. It's always a consideration. You can order a T cell CD3, B cell CD20, as well as just like a general heme marker CD45 if you're unsure, and as well as you can show a hematopathologist. Ewing sarcoma is a malignant tumor of neuroectodermal differentiation that often arises in the bone but can arise elsewhere. For instance, if it arises in the chest wall, it's called an Askin tumor. Histologically, you'll have these uniform, small, round blue cells. They can grow in sheets. They can sometimes be lobular. They can have elements of necrosis as well. You'll often see these pseudo-rosettes. And immunohistochemically, they will be positive for CD99, a strong membranous pattern. However, this is not specific because other tumors can stain for CD99. Other IHCs you can use include FLY1, NKX 2.2, and a PAS will stain the cytoplasmic glycogen. For board purposes, and if you're going to send for a fish, you're going to have to know the translocation. The most common one is 1122. That is a translocation with EWSR1 and FLY1. The lesser known translocation is EWSR1 ERG. Of note, EWSR1 translocations are seen in a lot of soft tissue tumors. So just an FYI. All right, let's talk about rhabdomyosarcoma. There are, I believe, 4 subtypes. The 2 most common ones are embryonal rhabdomyosarcoma, where you might have heard like that telltale Cambrian layer sometimes you can see, and alveolar rhabdomyosarcomas. So this is a malignant tumor with primary skeletal muscle differentiation. It'll stain with desmin, MyoD1, and myogenin. I like MyoD1 and myogenin because that stains immature skeletal muscle. So embryonal rhabdomyosarcoma, you'll have round rhabdoid cells. Sometimes they can be strapped like, your belt strap or tadpole shaped. They'll be eosinophilic and often in a myxoid stroma. If you look closer, sometimes you can see that cytoplasmic cross striations. And then your alveolar rhabdomyosarcoma, architecturally, they'll often be nested, hence its name alveolar, and they're larger, more rounded, undifferentiated cells with fewer rhabdomyoblasts. They have a distinctively strong myogenin positivity, and it has FOXO1 translocation. You have your 213, which is PAX3 FOXO1, as well as PAX7 FOXO1. PAX7, your 113 FOXO1 will have a better prognosis. So you have your 213 PAX3 FOXO1, as well as your 113 PAX7 FOXO1. Okay, Wilms tumor is also known as nephroblastoma. It's a triphasic tumor, although sometimes you might get different proportions and you might only have 2 or even 1 element. So it's important to know that. The triphasic tumor consists of the epithelial, your blastemal, and your stroma. Your blastemal element will be the ones that kind of look more like your small round blue cell differential. IHCs can stain different elements, so cytokeratins and WT1 will stain the epithelium. Your desmin and WT1 will stain the blastema, and your stroma will be weak WT1. Wilms tumor, the mutation is the Wilms tumor gene, WT1, and that's on chromosome 11. And that's important to know because you'll see that the desmoplastic small round cell tumor is also WT1. And so its EWSR1 was 22, and WT1, that gene is on 11, so it's 1122. Same as your Ewing sarcoma, but just different translocations. Okay. Some syndromes where you might see Wilms tumor include your Beckwith-Wiedemann syndrome, as well as your WAGR, W-A-G-R syndrome. Neuroblastoma, you'll see a lot of that small round blue cell. You can have a neurofibrillary matrix as well as rosettes. It's the most primitive amongst ganglioneuroblastoma and ganglioneuroma. This is a spectrum where neuroblastoma is the most immature, and if it matures more, it'll be ganglioneuroma, and in between will be ganglioneuroblastoma, which has intermediate differentiation, as you can see here with the neuroblastoma element as well as the ganglion cells. Ganglioneuroma, you'll just see ganglion cells set in a fibrillary stroma with no neuroblastoma. So neuroblastomas arise from the sympathetic nervous system. So it can arise anywhere here. And IHC, it'll stain for synaptophysin, chromogranin, CD56, MB84, and NSC, or neuron-specific enolase. You can stain for S100 to identify cytodifferentiated cells like Schwann cells. And you want to test for a MYC-N amplification, because if you do have that, that is a poorer prognosis. Okay, desmoplastic round cell tumor. It's unsure what the cell of origin is for this tumor, but it's often found in the peritoneal cavity in young men. It has that EWSR1, which is chromosome 22, and WT1, which is chromosome 11 translocation, so it's an T1122 translocation. Histologically, it's got these basaloid nests of small round blue cells set in a desmoplastic but cellular stroma. It'll be positive for cytokeratin, desmin, and WT1, but it'll be positive for the C terminus, which is the opposite of Wilms. To recap everything, just remember additional resources to help guide your differential of small round blue cell tumors include flow cytometry, cytogenetics, and freezing for additional studies. So here is your chart for your reference, but just the highlights for me. Leukemia, lymphoma, you can do a CD45 to see if all the round blue cells are positive. Ewing sarcoma, you can do CD99, which will be strong diffuse membranous, as well as a Fly1 and NKX 2.2, as well as a PAS. Rhabdomyosarcoma, remember this is immature skeletal muscle, so you can do a MyoD1 myogenin. Wilms tumor, this is arising from WT1 gene, so you can do a WT1. Neuroblastoma, you can do a synapto and chromo. And desmoplastic round cell tumor is also defined by translocation of EWSR1, WT1. So you can do a WT1, but you'll have to do it with the C terminus. So thank you so much for watching. We hope you enjoyed this amazing Hertz notes and video presentation. And we hope you have a great day. Bye.